I'm Dr. Melanie with Venture Chiropractic, and this week we have a guest, Alyssa Shirek from Fundamental Therapies. She is going to be covering some exercises and some things that you can introduce into your life postpartum to help you recover, feel better, move better, and really start feeling better in your skin.
Yeah, so like Dr. Melanie said, my name is Alyssa Shirek. I am an occupational therapist and a certified lactation counselor, and I own Fundamentals Therapy here in Fargo, and I treat women of all ranges postpartum. It's really a passion of mine.
This week we're gonna focus on breathing. If you don't have a good grasp of how you should breathe and get kind of in connection with your breath again, anything you do exercise-wise is not gonna be as effective for you moving forward. And Alyssa is going to talk a little bit more about the diaphragms and how they should be working so we can be as effective as possible with our exercises.
Yeah, so we actually have two diaphragms. We have a respiratory diaphragm and a pelvic diaphragm, and they need to be working in conjunction to really be effective at managing our inner abdominal pressure, which is just a big word for the pressure in our abdomen. Mm-hmm. So we have our diaphragm on top, we have our pelvic floor on the bottom, we have our abdominal muscles, and then we have our paraspinal muscles in the back. A lot of people, when they think about the abdominal muscles, think about the rectus abdominis, which are the six-pack ab muscles. But we actually have the transverse abdominis, which is a deep abdominal muscle, and that's something that we'll really be focusing on as we move forward with these exercises. Super important for everything to be working together smoothly, coordinated. We want your diaphragm to contract and your pelvic floor to support those organs that are inside. Mm-hmm. And if something gets thrown out of whack, then it can really do damage to the whole. Now we have Dr. Melanie on the floor. Obviously, this is something super easy, super simple that you can do at home. Put your baby down next to you to do tummy time, and then you can do your breathing exercises. So the first thing I'm going to have Dr. Melanie do is put one hand on her chest and one hand on her abdomen. And I really want her to think about her abdomen as a can of pop or a can of LaCroix. And when she takes a breath, I'm going to have her fill that entire canister full of her breath. And so it's a 360-degree breath. You're breathing down into your low abdomen, but you're also breathing into your back here. Have you just take some deep breaths. Your belly will go out. As women, we're so used to sucking in our bellies all the time, but we really want your belly to go out while you're doing this. And then as you become more and more aware of your breath, you might start to notice that as your diaphragm goes down, when you're breathing in, your pelvic floor is stretching a little bit to give room for those abdominal organs. And then as we're breathing out, our pelvic floor actually contracts a little bit. How does that feel?
It feels good.
Good.
Yep. All right. Hopefully you have learned a thing or two about the importance of your breath and how we should start breathing. Over the next few days, we want you to try and practice breathing. Remember, down and out, fill that canister as much as you can with your breath. Really feel it. You might get tired, but keep on going. And next week when we return, we are going to give you some other exercises that you can use as another launch point in your postpartum process. Thanks, Alyssa.
Yeah.
And we are here at Venture to help you move better, feel better, and be a better you. As a disclaimer, any of these exercises can be safely performed during pregnancy as long as you're not on any restrictions from your medical provider.
Yeah, we also want you to be really aware of how your body is feeling while you're doing these exercises. If you experience any pain or discomfort, please discontinue. We also want you to pay attention for diastasis recti, which is very common during pregnancy as it's the thinning of the abdominal tissue for baby to stretch, so baby has a place to go. However, we don't want you to be doing anything that is exacerbating these symptoms. So if you are noticing this coning or tenting, we want you to go back in the progression of exercises.
Everybody's moving, everybody's moving, everybody's moving, moving, moving.